Hi there, my name is Dr. Semide.
Hello, how are you?
Good, how are you?
Good.
Awesome. So I heard that you are having some fatigue. Can you tell me more about that?
Yes, I just been waking up and just feeling very tired right from the beginning, the start of the day.
Mm-hmm.
And I just been feeling very drained, very tired.
I see. And when did this fatigue start?
Probably 2 weeks ago.
Okay. 2 weeks ago. And would you say that it started suddenly or gradually?
I think gradually.
Okay.
Yeah.
And you mentioned that it's worse in the morning. So from 1 to 10, 1 being very little fatigue and 10 being so tired that you can't get out of bed, how would you rate the fatigue?
I will rate it a 5.
5 out of 10 in the morning. And then by the end of the day, how would you rate it?
By the end of the day, I would say maybe around 6.
So it actually gets worse at the end of the day?
Yes.
Okay. How about in the middle of the day?
Middle of the day, it's around 5 still.
5 as well? Okay. Okay. Can you tell me about your diet and exercise? So let's start with diet. What do you eat for breakfast?
I usually have 2 eggs and then an avocado toast.
Mm-hmm.
During lunch, I usually eat rice with vegetables and chicken.
Mm-hmm.
And dinner, sometimes I'll have some rice noodle soup.
Okay. Sounds like you're having plenty of protein. Do you have protein in your rice noodle soup?
Yes.
Okay, good. And what about your exercise?
To be honest, I haven't really been exercising. I would go on walks every day, but that's probably the extent of it.
Okay, so just walks every day. How long do you walk every day?
I would say around 30 minutes to 45 minutes.
Okay. Sounds good. How has your sleep been?
Not that great. I found that every night I would wake up at 4 a.m. and I would be awake probably until 6 a.m. and then I will fall back to sleep. And then I would have to wake up around 9-ish to 10-ish.
So you're awake from 4 a.m. to 6 a.m.?
Usually that time.
Every morning?
Yeah.
Do you know what wakes you up?
Usually I have to go to the washroom, or even if I hear like sounds within the house,
Mm-hmm.
I'm awakened by that.
I see. And overall, how many hours would you say that you get?
Maybe 6 hours.
6 hours in total? Okay. Yeah, that's definitely not enough sleep. I would say ideally you want to get at least about 8 hours of sleep. Right? So, are you napping at all during the day?
Recently, no. I've been really busy during the day, so I haven't really napped.
What have you been busy with?
Just like final assignments, final exams.
Mm-hmm. Is that adding a lot of stress on your plate?
Yes.
Okay. So from 1 out of 10, 1 being very little stress, 10 being so much stress that you can barely function in the day, how would you rate your stress levels right now?
7.5.
7.5, so that's pretty high then.
Yes.
Do you take medications at the moment?
No, I don't.
No medications? Any supplements?
Yes.
Which ones?
I take fish oil, I take magnesium, and vitamin D.
And vitamin D. Okay. Any multivitamins?
Yes,
Yeah,
I do actually take a
multivitamin.
multivitamin.
Okay. Any alcohol?
No.
Smoking?
No.
Recreational drugs?
No.
Good. Did you notice a change in appetite since your fatigue started?
I feel like I've been snacking more.
Snacking more? Do you think that has to do with your stress?
I think so.
Have you been more thirsty lately?
Yes.
Yes, as well. How much water do you drink a day?
Not a
Glasses-wise?
lot.
Not a lot.
Probably 3 glasses per day.
I see. Yeah, I would definitely suggest drinking more water. About 8 glasses a day is usually a good amount. Have you had any joint pain or tenderness?
No.
No. Any other symptoms such as dry skin, nails, any of that?
Mm-mm.
No. Any fever, night sweats, or weight loss?
No, I don't
No
think so.
fever, night sweats, or weight loss. Yeah. Do you find that you're still able to carry out your daily tasks?
Yes, but I find that sometimes, let's say I'm writing my essay, my eyes just start to get really tired.
Is that from sleepiness?
Yes, and I also think just screen time overall too.
Okay, so your eyes are kind of strained. I can definitely take a look at your eyes for sure. Have you had any bleeding anywhere?
No.
No signs of bleeding. Is there a history of anxiety or depression in your family?
Yes, anxiety.
Who?
My mom, my sister.
Mom and sister have anxiety. Okay. Is there anything else you'd like me to know about your condition?
No, I think we said everything.
Covered everything? Perfect. So I'm going to go ahead and start on your vitals. Please open up your mouth. I'm going to put this right under your tongue. And then close your mouth and you can just hold on to it. Go. Meantime, I'm just going to take your pulse. Take a look. Okay. You don't have a fever, so that's good. Let's go take your blood pressure, okay? First, relax your hand down this way. Please raise your hand and pump your fist 10 times. Okay, the blood pressure's a little bit low, 95/65. Is it typically low this week?
No,
Okay, we'll keep an eye on that. Have you ever felt like after standing up from a seated position, you feel dizzy, you see kind of stars in your eyes, that kind of thing? Yeah? Okay, so I'm suspecting that you might be dehydrated. So I'm going to make a note of that to definitely increase your hydration fluid intake. Okay. Okay, so I'm going to take a look at your skin. First, I'm going to start with your hair. And I'm just looking for any areas of thinning, any oiliness, any coarseness, which I don't see. So that's good. Just come back here, okay? Have you noticed any issues with your hair at all? Dryness, oiliness, more than usual?
No, just split ends.
Okay. Just look back here too. Okay, good. Seems very healthy. Okay, so I'm going to take a look at your skin as well as your eyebrows, and seeing if there's any lateral thinning, which I don't see. It's good. Have you noticed any rashes at all?
No.
Okay, just take a look. Nothing on your arms either. Have you been traveling or camping at all? No? Let's take a look back here as well. Okay, and it seems like you have enough moisture, even your hands, just feeling it, it seems to be a good temperature. You don't seem to have cold hands and feet. Let me check your feet as well. Okay. Okay, I'm going to take a look into your nose. So all you have to do is just kind of just looking for any redness or discharge, which I don't see. Come on this side. Oh, looks good. Do you have any issues with like nose bleeding or anything like that? Not much. Please open up your mouth. Just looking at your mucosa and seeing if there's any paleness. No cavities either. Can you say ah for me? Tonsils look good, grade 1. And no redness in the back either. Perfect. Okay. All right. I'm going to take a look at your lymph nodes. So I'm just going to go ahead and palpate. Let me know if you feel any tenderness, okay? Or any pain at all.
Just a bit tender right here.
A little bit here?
Yeah.
Okay, I don't feel any enlargement. Have you ever had any swollen lymph nodes in the past month or so?
Yes.
Where would you say they were?
It was over here.
Okay. Be sure to check that. Okay, it doesn't seem enlarged right now, so that's good. Did you have a fever at the time?
No. I just had an infection near my mouth.
Like a throat infection?
Mm-hmm.
When was this?
2 weeks ago.
Okay, interesting. And that's also around the time that you started feeling fatigue. There's a little bit of an enlargement right here, but it's mobile. Is it tender at all? Okay, I'm going to just go a little bit deeper. Other way. Okay. Now I'm going to be checking for your thyroid. So I just want you to kind of like that. Perfect. And this might feel a little bit uncomfortable, but I'm just feeling for the wings and seeing if there's any nodularity, any enlargement. That part's fine. Let's come on this side. No, that side's good too. And then the isthmus. Have you felt any discomfort or pain around here? Okay. Mm-mm. Just look straight ahead. Can you swallow for me? Looks good. No enlargement of the thyroid. Nodules or hardness. Anterior cervical chain. Okay. Good. I'm going to do a bit of a muscle test on you. So what I'm going to do is I'm going to kind of push on different parts of your muscle. You just have to resist against my hands, okay? Just testing the strength. So resist against my hands. So push up into my hands. Can you push up a little bit more? Okay, good. Push into my hands here. Like with your arms. Good. Like you can actually fully push like that if you want. You can keep your hands up and push into my... Good. Okay. Push into my hands. Good. Like this. Push into my hands. Good. Other way. Good. Hold on to my hands. Grip them. Grip, 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 grip. Good. Okay. Okay, and then your lower body. Push into my hands again. Good. Push, push, push. Good. Push, push, push. This way. Up. Good. Push down. Good. Push up. Good. Okay. Okay, so your myotomes seem to be completely intact. So we're going to do a bit of cerebellar testing. So for this one, I want you to hold up your hands like this. Okay? Very good. And down. So that's good. Pronator drift is negative. Okay. Here's one that might be a little bit challenging. I want you to touch your nose with a finger and then touch my hand. Okay? With this same one.
Oh.
Okay? Back to your nose, to my hand. Back to your nose, to my hand. Back to your nose. Okay, a little faster. You can look. You can look. Yeah. Good. Good. Perfect. And now we want to do alternating hand and hand movements. So you're going to do this on your, yeah, like this. Faster, faster, faster. Perfect. Okay. Coordination. So palms intact. Good. Okay, so we're gonna do your biceps reflex. I'm just gonna pull this up slightly. Okay, good. And the other side as well. Okay. I want you to just relax, relax, relax. Okay. Relax, relax, relax. Good. Okay, so now we're going to check your ankle reflex. Just relax for me. Good. Good. Okay, so your biceps reflex and your ankle reflex are both 2+. So that's good. Okay, we're going to do one more exam. I'd like you to lie down, please, with your head this way and your foot down there. Feet. Okay, so I'm just going to do a little bit of palpation of different organs. So I'll start with your liver here. Okay, I want you to take a deep breath in, please, and out. Deep breath in and out. Deep breath in. Okay, good. So your liver was non-palpable. I'm sorry if that hurt. Now I'm going to be palpating for your spleen, alright? So take a deep breath in and out. 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 And deep breath in and out. Okay. Your spleen's also non-palpable. Now I'm going to be examining your kidneys. Just finding that costovertebral angle there. Okay, take a deep breath in, please. And out. Okay. Okay. And your other kidney. For that costovertebral. You can relax onto me, please. Good. Okay. Take a deep breath in and out. Okay, also non-palpable. Perfect. You can get up now. Alright, so good news. According to all your exams, everything seems to be normal. Nothing that I picked up that was abnormal. Okay, so based on our history intake, however, you were saying that you're feeling very stressed out. You said it was a 7.5 out of 10, and you weren't sleeping well either. So, and you're also not drinking enough water, which of course can definitely mean that your body's going to be a bit more fatigued just because we're not getting enough water to all your tissues, right? So we want to make sure that we have a plan set for you like that. I'm actually going to refer you out to a naturopathic doctor. She can take really good care of you and kind of give you some supplements, give you some lifestyle diet advice. In the meantime, I do want to make sure that you drink 8 glasses of water, make sure you're getting 8 hours of sleep, and that you're also finding ways to cope with stress. Do you have any ways that
I've been meditating
every day?
That's been helping. I try to do it every day.
Okay.
But I will put in effort.
Okay, and how many minutes do you meditate a day?
The meditations are usually around 20 minutes.
Okay, that's very good actually. Do you find that that's been helping at all?
Yes.
Very good. Okay. Awesome. So that's it. That's it for me. Thank you so much for coming in and taking such an active role in your health, and I'll see you next time. Okay?
Bye-bye.